head, eye, ear, nose, and throat assessment. I'm going to start off by looking at the patient, assessing for level of consciousness, orientation, eye contact, overall cleanliness, looking at the head and hair distribution. I'm going to palpate the scalp, feeling for any lumps, depressions, any contours, feeling for the occiput in the back. Assessing the face, making sure there's good facial symmetry. I'm going to palpate for the temporal artery and feeling the temporal mandibular joint. So move your jaw, okay? Just feeling for, make sure there's no limitations there or crepitus. He's able to freely open up his jaw. Going to feel his facial sinuses. Tell me if there's any pressure there.
No.
No, okay. Moving on to the eyes. For a full eye assessment, we would use the Snellen chart and have the patient cover alternatively one eye and read the lowest line that they can. But we don't have one today. So just going to look at the outside of the eye, make sure there's no signs of infection, no excessive drainage or dryness. Looking at the sclera, making sure that it's nice and white in both eyes. I'm going to pull down here, look up for me, and looking at the conjunctiva, making sure it's nice and pink. And going to assess for perla here. And making sure that the pupils are equal, round, and reactive to light and accommodation. Moving on, we're going to do a confrontation test to assess his peripheral vision. So tell me when you see my fingers.
There. There. There.
Okay. And then we're going to do the 6 cardinal signs of the gaze test, looking for his eye movement through the cranial nerves. So just follow my finger. Okay, and just follow my finger in. Good. And moving on, we're going to go to the ear. Just going to look at the outside of the ear, make sure that there's no drainage, no lesions, assessing, making sure that the skin is intact. Going to do a tug test. Tell me if you feel any pressure there.
No.
Okay. Okay, and then we're going to look at the tympanic membrane by pulling back the pinna up and backwards. Just assessing the membrane, making sure that it's nice and clear, there's no signs of infection. And we're also going to do a whisper test, so cover your right ear for me, and then you tell me what you hear.
Baseball.
Okay.
Football.
Okay. Moving on, we're going to go to the nose, assessing for symmetry of the nose, making sure that there's no deformities. Go ahead and occlude one nostril and breathe out. Okay, and the other side. Okay, and we're just assessing, making sure that he's able to breathe equally out of both sides, that there's no occlusions there. Go ahead and lean your head back for me. And using the light, we're just going to assess for any drainage, making sure that there's no septal deviations, no lesions, and making sure that his membranes are pink and moist. Going to go to the mouth now, looking for any lesions, dryness on the outside of the mouth. If you'd open your mouth for me. Assessing the teeth, making sure that there's no missing or broken teeth. Assessing the oral mucosa, making sure that it's nice and pink and moist. Go ahead and open up your mouth, stick your tongue out for me, and say ah.
Ah.
Okay. And assessing the cranial nerves there and his gag reflex. Looking for his tonsils as well. This patient doesn't have tonsils, but we would grade tonsils if we saw them. And making sure that the uvula is in midline. I don't know if I said that already. And you can pull your lip down for me. We want to just look at the gums and make sure that there's no lesions or bleeding or any signs of infection in the mouth. Next, we're going to go to the neck, just looking for any lumps or deformities, any signs of a goiter in the neck. I'm going to assess for the carotid arteries and looking for any jugular vein distension as well. And we're going to assess for range of motion, so just go ahead and move your neck around for me, side to side, front to back, okay? And just push your head against my hand, okay? Push again. All right, and then shrug your shoulders for me, okay? Just assessing the cranial nerves, making sure that he's able to move his neck and he's got good muscle strength. Gonna also assess for any lymph nodes, so starting in the preauricular area, postauricular, the tonsillar, submandibular, and submental, and then moving to the anterior cervical, post-cervical, the deep cervical, the supraclavicular, the infraclavicular, and then the occiput. Lastly, we're going to palpate the trachea, make sure that the trachea is midline and there's no deformities there, that it's not excessively moving around, and then we're also going to palpate for the thyroid. So go ahead and swallow for me. Okay, and we're just feeling for the thyroid there and making sure that we don't feel any goiters or masses. And that should conclude my assessment.